All right, let's continue then with blood vessels today. The science of blood vessels is called what? Angiology. Angiology. So angio will be vessels. So we're going to look at the blood vessels in the systemic circulation, which will start, this will be systemic circulation. Going, if we have the heart and our four chambers, our left ventricle, our right atrium, and we'll follow arteries. The ascending aorta is coming out here, but we're just going to call it an artery for the moment, coming from our left ventricle. This will be an artery. And then gradually it will decrease. Whoops. Gradually, just 1 second, I'll get rewired. It will gradually decrease in size to form arterioles. Arterioles. These are smaller, and then continue to decrease in size down to capillaries. These are our capillaries. And then we come back up on the venous side in small veins called venules. Venules. And these will enlarge to form veins and bring the blood back into our right atrium, giving us a circulatory system here. And this will be our veins. Now, all of these vessels have 3 layers. Except what? Capillaries. Capillaries will just have 2. They'll have endothelium plus a basement membrane. Some authors like to use the term lamina, a basal lamina. Same thing. So now what we'd like to do is begin with arteries. And there are 2 major classes of arteries, elastic arteries and muscular arteries. And we'll begin with the elastic arteries because they're the ones coming out from the heart, so that they're going to be expanding. They need elastic tissue. Can I take this off? We call the coats, or the layers, of arteries tunics. Tunics. So we'll have the the layers, ill-defined here, just those are tunics. The opening is called what? A lumen, yes, a lumen, to give it its specific name. So what we'd like to start with will be the tunics on the elastic arteries. We said we had 3 of these layers. So these are our elastic arteries. We're going to start with the first one, which is the tunica intima. So this is inside next to the lumen. Well, we'll have endothelial cells because throughout your whole vascular system, you're lined with endothelial cells. Endothelial cells. Plus connective tissue fibers. And these will be primarily elastic. Then we'll have the tunica media, the middle layer, tunica media, which will have predominantly elastic fibers. Plus a little smooth muscle. A little bit we'll put of smooth muscle. Now our third layer, again, it's a tunica, the tunica adventitia. Adventitia. And again, for these elastic arteries, lots of the CT will be elastic fibers. But also collagenous fibers for strength. The adventitia has something else that the other layers do not have. It has the blood vessels of the blood vessels. So we'll find the blood vessels of blood vessels in the adventitia layer. The correct name for this are vasa vasorum. Vasa vasorum. It's funny how you remember things. I remember when I first learned that when I was your age. Vasa vasorum, just saying it now, it's all up there. So this gives us then the wall of our elastic artery. Now, where do we find elastic arteries? We'll show them coming from the heart. So this will be, what are we calling them? Do we call them names? I say examples of elastic arteries. So one is going to be our ascending aorta. We know that it's coming from the left ventricle. So we're going to put in one coming up. Equals the ascending aorta. Does anybody know what the first branch off of the ascending aorta will be? What's the most important thing? Coronary artery. I always tell it's a good philosophical point. Take care of yourself so you can take care of everybody else. The heart takes care of itself first. The first branches off of the ascending aorta will be the right and left coronaries. We're just going to put them in here. So this will be number 2. Right and left coronaries. And then number 3, as we come up, going to go off in this direction. This will be the brachiocephalic. Brachial, what's brachio mean? Arm, cephalic, head. So this will send branches down the arm and also to the head. And also the term that used to be used, but when we have our vascular surgeon come in, he uses it still. So I'm going to give it to you. So you know that it's the synonymous artery of the brachiocephalic is also the innominate. Innominate artery is the same. And now our next one will be the arch of the aorta, going off in the opposite direction here. Big arch. It's about an inch in diameter. Unless you get an aneurysm here, gets to be 5 inches. That's something. Take good care of your blood vessels. Number 4 will be the arch of aorta. And then we'll come back and put in the left subclavian. This will be 5. Left subclavian, what does that mean? Under the clavicle, just palpate your clavicle. You know you've got a subclavian under there, a big vessel. And off of the subclavian in this direction, we're going to have the right common carotid, number 6. Whoops, I put left. I'm sorry. That should have been right subclavian. I apologize. This is definitely right. I apologize. Then 6 is the right common carotid. And then we can follow over to the opposite side where we'll have 7, which will be the left common carotid. left common carotid. And 8 is what then? Same as on the opposite side. What do we have over on the opposite side? Subclavian, sure. Left subclavian. So these then are your elastic arteries. So when you have systole down here in the ventricles, that pump is going to expand these arteries. And then when they recoil, they keep the blood propelled to keep it going around the body. So that's why you need elasticity, and we'll see what happens when you lose it with aging, which is a possibility. All right, let's take then a few of these as examples and expand upon them. Let's take the coronary arteries. Can I take this off? No objection. Thank you. So coronary arteries. Why do we take these arteries? Because a third of the population that dies in the U.S. will die of heart attacks. Blockage of your coronary arteries. Or what are commonly called heart attacks. So a third of the population that die, a third of deaths in U.S. in a year are due to heart attacks. So it does sound as it's important that you understand the mechanism. What happens? What are we going to do first? We're going to be obstructing the tunica intima, the first stage in getting plaques in arteries begin in tunica intima. What do we call when we start getting plaques in our arteries? What's the term? Atherosclerosis. Plaques in arteries. And these plaques can be rich in cholesterol. That's why you watch your diet. In fact, it's been reported that some $25 billion are spent in a year on anti-cholesterol drugs. On anti-cholesterol. Drugs. So it's very important when you get your physicals when you're young to find out your cholesterol level in the blood. So you know what you're treating, so you can watch it. Because if it gets above 200, then it becomes more dangerous. Cholesterol, it's just the number used. 200 plus becomes dangerous. No. So it's very easy to get your blood tested and to find this out and to know how to change your diet. If you're eating ice cream every other day, you know to switch to yogurt. You just learn there are substitutes for the heavy fats. You can do it, but look at how many people do not. Tremendous. So now, let's see where we want to take this. Say that you've got your coronary obstructed. How are you going to get rid of the obstruction? You have an obstructed coronary. You'll have an operation called angioplasty. Most have heard of it today. Angioplasty. That's the operation to remove plaque. Basically, there are 2 steps. We can use some of the basic anatomy that we've learned. We're going to inject a radio-opaque material into the femoral artery. Where would you go to the femoral artery if you were going to inject something? What do you call it? Femoral triangle, sure. So you know where it is now. So we're going to inject a radio-opaque substance into femoral triangle. And this will outline your blood vessels so they can be seen with an X-ray. So can X-ray. So with this technique, you can localize where is the obstruction in the coronary artery. Localize obstruction. So now you know where it is. So the second step will be to insert a catheter in the femoral artery. Insert catheter. A catheter is a tube, and at the end of the tube there will be a balloon, because what one's going to do is inflate the balloon to push the plaque to the wall. So insert a catheter with a balloon, and the balloon is in what's called a stent, with a balloon in a stent. What is a stent? In this case, the stent is a wire mesh tube. Equals a wire mesh tube. So here we are with our catheter, and it's got a balloon attached to it here. And surrounding the balloon will be this stent. Wire mesh. And we're coming into an artery with a plaque. So this is a plaque This is my artery. When they get there, then they will inflate the balloon, and it will extend this stent up against the plaque. Then we're going to insert catheter way down here in the groin, thread it all the way up through your abdominal aorta, around through your arch and around to the ascending aorta and into your coronary artery. That's where we are here. And here we'll inflate the balloon. Enlarge stent to press plaque against wall. And then you can remove the balloon and the catheter and leave that stent in place. There was a professor in endocrinology, I'll catch it in a second, and he had an obliterated or a blocked coronary, but he got to watch the surgery, and he could see that no blood was going into his coronary that was blocked. And as soon as they put in the stent and he saw the blood, he said that was one of the greatest thrills in his life, to know that his heart was once again going to be refurnished. He came back, and I was in lab, and he came in and disturbed to tell me the excitement. So let's hope that you keep healthy arteries so you don't have to do that. Yes? To a degree, yes, but not wholly. It's not going to be that big, right? Not until you get up here and get it, and then get this out. All right, that's very clever. What are they doing today? This is very common, but they're using a laser to vaporize the plaque. They have a catheter with a laser, and they thread the catheter up to the plaque and then activate the laser, and it disintegrates the plaque. It vaporizes is the term they use. Vaporizes plaque. So what next with technology? That's why you take these basic courses to see how you're going to improve things. Yes?
So does the stent stay out?
Yes, the stent stays in there. Right. All right, so that tells us if you get a plaque in your coronary artery. What happens if you get plaques in your common carotids? I think we'll come back to that. Let's see which one we want to take now. No, I can take common carotids. So it's quite common to get plaques in your common carotids. So we have our common carotids coming up. Here we had our heart. We have our ascending coming over to our loop, and our common carotid on the left, our brachiocephalic out here, and our common carotid on the right. And they'll stay as common carotids till they get up to the superior boundary of what? what is this in here? This cartilage. No, thyroid's not cartilage. It's the larynx. We'll study the larynx. It's part of your respiratory system, and it has to keep cartilage, to keep it open so it doesn't collapse. But at the superior border of larynx, the common carotids bifurcate. Common carotids bifurcate. Bifurcate into an internal carotid and an external carotid. So internal carotid and my external carotid. At that point of bifurcation, that is a common site for plaques to form, because you're coming up and you hit the top here before it goes off. So plaques commonly form at bifurcations. In the carotid, this area is important because we have two sensors here. We have a carotid body. Again, this is at the bifurcation. Of common carotid. We have the carotid body that regulates blood pressure. Regulates, this is in the wall of the artery, regulates blood pressure via the ninth cranial nerve. We also have a very important structure, the carotid sinus. What does a carotid sinus do? It regulates respiration by sampling oxygen in the blood. Regulates respiration by sampling oxygen. So you can see how important. Feel in your neck. Feel your larynx. It's your Adam's apple, common term. So you know just to the right there will be this bifurcation of your common carotid, and that you have these very important sensory mechanisms right there in your neck as far as your blood function goes. So let's look then at what happens if you get your plaques in the common carotid. As we go down, get plaques forming here. How are you going to determine whether there are plaques there? Fortunately, you don't have to come up through the femoral artery clear into the neck. What can they use to determine plaques in the neck? Ultrasound. With ultrasound, you can determine plaques in the ultrasound. To determine plaques in common carotid. And they are quite common, these plaques in this area. So older people get ultrasounds to see if they have plaques. What do they do if there are plaques? They do a procedure called endarterectomy. 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 That's procedure to remove plaques in common carotid. And I was just reading yesterday that they're saying that on many people over 80, it's still safe to do an endarterectomy, and it certainly increases the blood supply to the brain. There's the typical story they tell about the executive who was losing his memory, and his secretary kept trying to make up for it. But finally, she talked him into getting an endarterectomy, and they went in and cleared out the plaques, and he could get the blood again going to his brain, and his memory came back very well. So there are lots of reasons for decreasing memory when you get older. You've got to consider the health of your vascular system. So these then give you some examples of our elastic arteries and what they do and how we can keep them healthy. Let's look at our muscular arteries then, because obviously the majority of your arteries are muscular arteries. I've only given you 8 elastic arteries. So we have muscular arteries. Have you ever thought about your arteries before? Not too often. They're down on the list, are they, when they're so important? These are also called distributing. So how are you going to tell the difference between a muscular artery and a distributing artery? By its coats. You have a tunica intima. Let me get more room. Tunica intima. Sure, it's going to have its endothelial cells. And some connective tissue. But it also has an internal elastic membrane. Internal, when I show you pictures, you'll see how distinct it is. Internal elastic membrane. I mean, if a third of us are going to die of vascular problems, I think we should really be well aware of what our blood vessels are. We've got a tunica media. Who was the professor in anthropology a few months ago? Died in front of his class? Had his heart attack? Can happen. Tunica media. You're all going to look at me funny now. When are you going to die? Okay. Tunica media. Since these are muscular arteries, we're going to find the whole media filled with smooth muscle. smooth muscle. And then the tunica adventitia will be connective tissue, collagenous fibers. These are predominant. But you can begin to figure out if you want to get a tough protective coating around an artery, you're going to put in collagenous fibers. This will protect the artery and give it strength. So it definitely will then have, in addition, we had an internal elastic membrane. Our adventitia is going to have an external elastic membrane. So we'll see pictures. So these are the three constituents that we have in the walls of our muscular artery. Now, a few examples then of muscular arteries. Let me take the internal carotid. You saw where it divided. It's going to feed 75% of your brain. This whole brain is getting fed by the internal carotid. Supplies 75% of the blood to the brain. So you see how important, you can see why they're called carotids, which, what did carotid mean? Stupor, right? Press on them. Look at how much blood you stop going to your brain. Terribly important. First branch of the internal carotid will be the ophthalmic artery. Where is it going to be going? To the eyeball. Ophthalmic artery, very important for you to see. Ophthalmic artery goes to the eyeball. Now, when you take advanced anatomy, you get all the arteries coming off of internal carotid. I'm giving you two. The first and the terminal branches. Terminal branches. Anybody know the terminal branches? Going to supply your cerebral hemispheres. The anterior cerebral and the middle cerebral. Anterior cerebral and middle cerebral. So we can show how much of your cerebral hemispheres are supplied, thank you, by these two arteries. I'd like to finish if I could. So if we look at a lateral view of cerebral hemispheres, I learned yesterday that we're establishing a new institute called Theoretical Neurobiology, and they'll be studying only the cerebral cortex and the thalamus leading to it. Fantastic, big new thing. So here's our lateral view. Our medial cerebral artery will be supplying an area like this. All of this side. Put your hand on the side of your head. You have your big hemispheres beneath it. In red, we've got the middle cerebral supply. And we'll put anterior cerebral in blue, even though it's artery, just to distinguish it between. So this is all anterior cerebral. And just one more thing here. We'll pick up the vertebral next time. There's a very important area here on the inferior frontal lobe. This is left side. What is it? Broca's area, right. X equals Broca's area. This is motor speech. For me to be talking to you now, mine is firing, getting more blood supply. Motor speech. Students will come in and say their grandmother had a stroke. I say, tell me one symptom. She can't talk. You know immediately that it was a middle cerebral. And this is a question you'll get asked when you start on the floor with your residents. What vessel supplies lateral cerebral cortex? And I want my students to say, what? Come on, all this work and they say nothing? Middle cerebral, don't forget it. As more students come back years and say, well, thanks for telling us, because that was a very question when they get to the brain they ask, because it's a large supply. We'll learn when we study the brain how much more is supplied here. Let's look at slides. We have just a few minutes and we have some good slides, so please, let's move forward. Slide first. This is an elastic artery. This is the lumen. The endothelial cells are here, very thin, but all the wavy lines are elastic fibers. You can't see that there's one layer, then the middle layer, then the outer layer. There's so many elastic fibers. In contrast to a muscular artery, next slide, look at that. You can distinguish, here's my internal elastic membrane. Here are my endothelial cells. This then is my muscular layer. This is all smooth muscle. And this then is our adventitia. Very clear differentiation between connective tissue, smooth muscle, internal elastic membrane, endothelium, and the lumen, in this case, is filled with blood. You wonder how they got that tissue. Why isn't it clear? Why is there blood after death? Who knows? Next one. Now, this is a longitudinal section of a muscular artery, because you're going to see them. When you get to path, you have to be able to see every different slice to tell what it is. You might say, well, this is an abnormal. No, it's not abnormal. Your endothelial cells, here's the internal elastic membrane, here's your muscle cut and cross section, and here's your connective tissue. Next one. This is an arteriole. It's much smaller, and these are circular smooth muscle cells around it. It will have its little connective tissue, its endothelium, but greatly reduced in size because it's feeding into the capillaries. Next one. And this shows then the arteries we've been mentioning. As we see the ascending, they put off some little coronaries here, and then show your brachiocephalic here, and then a common carotid. We didn't get to the vertebral, but we will next time, because the vertebral will be supplying 25% of the blood to your brain, but it's coming up the back of your neck. And so you follow the common carotid up, and the external carotid's going to go external and supply your face and scalp, while the internal goes into the brain. Next one. And this shows at the brain, here's your middle cerebral supply. Here's your middle cerebral artery, this whole big circle here. And if this were a left brain, Broca's area would be about in here. This shows a medial slice. We've cut through the brain. Here's your corpus callosum. Here's your anterior cerebral artery. When they first started split brain preparations to cut the corpus callosum, they kept getting bleeding because this anterior cerebral hugs the corpus callosum. And I learned from some of the lesser people down at Caltech, when they cut, they finally learned not to go so far forward, and they left a little corpus callosum, even though they called it a split brain preparation. They didn't want to get this artery. Next one. And this is what it looks like if we take all the brain away, and that's the arterial supply of your brain. Don't you appreciate it? Now picture that inside your skull. Transpose it. When we study the brain in detail, as we do in the graduate class, then you get all those arteries. You see, I'm giving you just a suggestion. Don't you appreciate your brains?